We've got a great speaker. It's my honor to introduce Mark Brownstein, the Director of Medicare for Emerald Medicare. He's got decades of experience as a trusted advisor with full licensing across 20 states. So for our friends outside of New Jersey, there's a chance, about 20 out of 50, that Mark can help you. He's a renowned leader in Medicare protection, a three-time president of his local financial planning association chapter, known for his unwavering commitment to high standards and service quality. He's built a career on objective education, ensuring clients can receive the best Medicare solutions for their changing needs. He hosts 2 local radio shows on senior-related topics, sharing knowledge with the community, having assisted over 1,500 clients personally and conducted workshops for 3,000 plus individuals and trusted advisors. Mark's expertise is unparalleled, and I'm very excited he is here. He's also a certified senior advisor dedicated to improving seniors' lives. So everyone, please welcome Mark Brownstein, a true expert in Medicare, elder care, all of the things. Mark, thanks so much for joining us today.
Well, thank you, Justin. Thank you, David. It's a pleasure to be here with all of you on this virtual education around Medicare. And so just real quickly, the picture on this first screen is me 25 pounds heavier. And so I'm proud to say that I lost 25 pounds, but I also have a staff of 7 people who are not in this picture. And so we're a 12-month-a-year organization that does nothing but Medicare. We help about 1,000 people a year understand Medicare, educate them on Medicare. And just so that you know, my services are no cost at all. Any call to our office is absolutely free. We represent 17 different insurance companies. And so we are independent, objective, and unbiased. We're always going to do what's in your best interest. So with that said, this is the compliance screen, and I'm going to launch into this presentation at this time. So again, thank you all for being here. So I'm the Director of Medicare, as Justin had said. I've built my career on training in healthcare. I consider the fact that Justin and David have brought me in today to be really important, because trusted advisors need to know other trusted advisors. And being a Medicare specialist really gives me the opportunity to work with financial planners who really see the big picture of people's financial needs, and healthcare is certainly one of them. But not only do I work with financial planners, I work with CPAs and medical office staff and human resource professionals, and of course, veterans who often need some other guidance around the services that Medicare provides. I've conducted a lot of workshops. I am a local resource for my local healthcare systems. I'm active in my local community. I believe that that is really what it's about, is giving back. This is a topic that everyone needs to understand and is often very confused about. The agenda today is how to navigate Medicare in retirement, or just navigating Medicare. Some people are actually still working. Medicare has its history, and it's interesting to see how Medicare has evolved over the decades with the various administrations. But decisions are the same, and in some cases different for everyone, and we'll go over that. There are enrollment periods where people get confused, and that's really often where the conversation with myself or my team starts. It's, what do I need to do when I've been told if I don't do certain things? There are, again, rules, missteps, penalties, timings that people are not quite clear on. They get misinformation, they get information in their mailbox and looking at things on TV, and they really are confused. There's something called IRMA, which is an income adjustment. And again, people feel like it's a penalty, but it's an income adjustment. But there are ways around it, and I will talk about it. COBRA and the Health Savings Account, HSA, are often very misunderstood, and I will cover that. But the core of making decisions is often looking that they can either stick with their doctors, and what are the costs of their medications. Medications are actually the most important thing for many people. And as you know, the administration these days are doing a lot to try and negotiate with Medicare to help reduce the cost of some of the high cost drugs. And I'll talk about that. There are some Medicare changes for 2022, 23, 24 that I'll talk about. And then Med Advantage and Medigap. That's really key choices that people have that we'll cover. And then for those people who are on Medicare and or Medicaid, there are special plans for them. So, people are confused, they're lost, they're unsure. And no matter who you are, this is often the first time you've had to make your own decision on healthcare. People who have been working have had a few choices at their company, but this is a chance for them to make their own decision, though it is confusing, and they really do need someone who can walk them through it patiently and then explain to them what their options are. So what do I do when I turn 65? Can I defer Medicare Parts A and B? What if I'm not ready to retire? Do I need to do anything? So, I always say reach out at 64 and above, though there are people who reach out at age 60 because they're retiring and they just want to know what Medicare will look like in the future. So people want to know what to expect, maybe what some of the costs are. That's what financial planners will do, is look at the projection of cost that Medicare and maybe even prescription drugs might cost them as they put it into their financial plan. So top concerns, certainly running out of money is out there, but certainly healthcare costs. It's important, and it continues to be important in people's lives. People want to know what it's going to cost. People know that they have to spend money on healthcare. It's not free. And then there's dental. And so we'll cover dental as well, because dental costs are sort of this component of seniors' care that is often not covered very well in Medicare. So what is Medicare? Medicare is really a government insurance program for people 65 and older. People often get it confused with Social Security, which can start at 62 for some, but Medicare is 65 and older, except for people who are on Social Security disability for 2 years. At 2 years, people will get a Medicare card if they're on Social Security disability. So there's a little less than 10% of the population of people on Medicare who are actually under 65. Some of the plans are the same, and some of the plans are slightly different. It's administered by CMS, which was in the news a lot during COVID, monitoring some of the nursing home activities. But the enrollment is through the Social Security office. Again, that's why the confusion around Social Security is that Medicare and Social Security is all handled through the same website, as well as through the same office that you might someday visit. But is not connected with veteran benefits, but it is often available to enhance veteran benefits. A brief history. In 1945, Harry Truman introduced legislation, generic legislation, for all Americans for national health insurance. But it was Eisenhower and Kennedy who really looked at these engaged voters, which are still engaged voters, the seniors, and tried to figure out a way to insure them. But it was actually Lyndon Johnson, as many of you might know, who signed Medicare into law. Part A, hospital coverage, still Part A the same. Part B, all the outpatient services, all of the doctors, the treatments outside the hospital was and still is Part B. But it was the 70s through the 90s that between Nixon, Bush, and Clinton, they really developed what's called Part C, which is C for choice. And C for choice is allowing these Americans to get benefits through a private managed care plan. These are really very popular these days, and many people are actually very unsure about how these managed care plans work, but they are becoming more and more popular because of some of the benefits that they're offering. But Part C is still in place now. But it was George W. Bush who actually put in Part D, prescription drug plans. More than 60 million Americans are on Medicare now. It will be 80 million by 2030, which isn't that far away. A lot of Americans are using Medicare, and they need to understand it. So health insurance is in fact different for everyone, because there are so many choices that you have in coverage at age 65, post 65, or when you're retiring. I just spoke to someone from Pfizer today. They're offered a beautiful plan. All they needed was Medicare A and B, but Pfizer offered them a great plan. Not all plans in retirement are great, but high deductible plans. Many companies have a high deductible plan actually to save premium. You cannot have Part A and have a health savings account. A high deductible plan, by definition, generally has a high deductible and has a HSA available to it. Contributions to an HSA can be used for a long, long time. The contributions are pre-tax. But if you apply for Medicare, you cannot have Part A or Part B. So many times when I'm speaking to people, I am asking them that specific question. And many people do not get Part A because they love their HSA. So that's important. But how does this plan that you have being offered to you as group coverage or retirement coverage, how does it compare to Medicare? The only way to do that is to look at your current group plan or your retiree package, like I did with this Pfizer scenario. We looked at it, we talked about Medicare, and it was stay the course, stay with what you have. But that's not always the case. So I always look for what's called a benefit summary, trying to get an idea of what is being offered, what is the deductibles, what are the copays, and what are the out-of-pocket maximums. Now let's compare it to Medicare. So what are those premium costs? The premium cost for the employee may be very different than the spouse. Is there a savings? There may or may not be. The spouse is usually not covered as well. There isn't as much of a stipend or assistance with the spousal premium, but very often people have to go back to their HR department because their paycheck doesn't necessarily reveal the information. So is there a savings? Let's look at your current plan. Let's look at the copays, deductible, and out-of-pocket maximums, and let's make an intelligent decision going forward to determine if Medicare is better or you're staying on the plan that you're being offered. But at 65, are you being offered COBRA? Well, COBRA is generally expensive. It's the full premium. There are some cases, not a lot, where actually COBRA or the current coverage actually offers better prescription drug coverage. That is about the only time when I ever say to anyone, COBRA will work, because prescription drug costs can be lower than a Part D prescription drug plan. But COBRA is something that is expensive, and generally speaking, people will move on to Medicare as soon as they can. How does your transition to retirement impact your timing to Medicare? Well, this is a really important question because even if you get Part A is premium free. Part B is not. So the timing of retirement is often how much notice are you giving your employer? Are you giving them 2 weeks or are you giving them 3 months? And because they need to sign a form, you want to make sure that the timing of your retirement and the timing of you accessing Medicare is coordinated. So again, people call me, they call me 3 months later, they say, oh, I'm not retiring. Oh, I changed my mind. But you don't want to start getting Part B and being charged for Part B until you're absolutely ready to make that decision to retire. That's important. The carriers are offering various plans, and it varies by your state and your county. So whenever people move, I tell them to call me 2-3 months before they're going to move, because there are different rules in different states, and there are different plans in different states. And so planning the move, maybe having the plan in the state you are in before you leave, or knowing what plan you may be going to, or maybe trying to find out what new doctors you may be getting in the new location. All of these things are important, subtle, but help guide you in the right direction. At the end of the day, folks, finding the coverage that fits your health and your budget is my goal to help you, because not everyone can afford the best plans in America. And that's fine, because there are ways in which you can save money and get a plan that might have some benefits that you really like. Original Medicare, that is strictly Part A and B only. You have to have Medicare A and B if you're retired on a retiree program. So even if you're working for the government or you're working for the school district, you have to have A and B. And you may take their retiree program, but A and B becomes the key. So you'll always have A and B. A and B is 80% coverage. So A is a hospital, again, premium free, as long as you work 10 years or your spouse has worked 10 years. And you can defer it if you have this HSA I mentioned. But Part B is not free. And that's what I just mentioned earlier. If in fact you are not ready to retire, then getting Part B can be delayed. Because right now, Part B is $164.90 a month per person per month. Well, it could go up from there, and I will talk about that in a few moments. But again, all the doctors, all the x-rays, the diagnostics, all the durable medical equipment is all Part B. You don't need Part B if you have a group plan. If you're retired, you do. The timing of Part B is a huge part of what we do in our company and my staff, because we want to make sure that they don't pay for Part B before they need to, but they get Part B when they need to, because this is the area where a penalty can incur, is the timing of Part B. What does Medicare not cover? People think Medicare covers everything, is the answer to all their medical woes, but it doesn't cover long-term care, chronic care. It doesn't cover hearing aids and exams. You can get some of those over the counter, but dentures, acupuncture, routine foot care, routine dental care. In terms of the dental, that's a whole nother subject I'll cover a little bit at the end. But in terms of eye care, cataract surgery, diabetic eye checkups, glaucoma, that is part of specialty treatments, right? Ophthalmology, optometry, those are covered, but not eyeglasses per se. So these are things that original Medicare doesn't cover. But if you've seen the commercials on TV from Joe Namath and others, you see that many of the Advantage plans cover some of this. And that's what entices people to move towards an Advantage plan. Is Medicare automatic? The answer is both yes and no. If you are collecting any kind of Social Security, then 2-3 months before you turn 65, you will get your Medicare card. You'll get your Medicare card that has both Part A and Part B on it. So if somebody has decided to get Social Security at age 62 and they turn at 65, they get their card, but they're working full time, they don't need to have Part B. In that case, on the back of the card that is sent to you, one needs to sign and return the card back to the Social Security office so that you are no longer charged for Part B and you get a Part A only card. So again, the government will be happy to take your money and take it out of your Social Security check. So many people don't realize that they can reject Part B if in fact they don't need it. Again, another important nuance that is important to understand so that people aren't overcharged for something they don't need. On the other hand, if you're not collecting Social Security, then you need to be proactive. It's not going to come to you automatically. Even if you turn 70, okay, when you're actually collecting full Social Security, you need to apply for Medicare. So being 65 and Social Security, automatic. Being 70 and retiring, you have to actually go online, go to a Social Security office, and sign up for Medicare. There'll be no penalty, which is what a question often comes up. But the one thing that is important to understand is that anyone who is unemployed, self-employed, or working for a company of less than 20 employees must get Medicare A and B. Again, unemployed, self-employed, or working for a company of under 20 employees, they must get A and B. They can keep their group coverage, but they have to have Medicare to be primary. Again, mistakes have been made. People have gotten penalties for this reason. But large corporations, I tell people, just wait till you retire or your spouse retires. So this is important. So this, on the very top here, it talks about this 7-month window, which people talk about all the time. This is the 3 months before the month of the birthday, the month of your birthday, and 3 months after your birthday. Well, that's really, again, for only people who are unemployed, self-employed, or working for a small company. You can apply for Medicare if you're working for a large company at 65 or 75, and there is no impact. But this initial enrollment period is for just that small group of people. COBRA. I mentioned COBRA earlier. COBRA is not considered credible coverage. So if you are on COBRA and you are retired, you must get Part A and B. So this has gotten a lot of people into some trouble because Medicare needs to be primary and the COBRA plan will be secondary. Most people I work with, again, except for the people with prescription drug plans that are really priced better, don't wind up going on to COBRA. But as soon as we hear in our staff that someone is looking at COBRA, we all of a sudden pay attention because we want to make sure that no one gets into trouble around COBRA. The HSA component I've mentioned as well. It's a great opportunity to have pre-tax contributions. Legally, you're supposed to stop contributing 6 months before you enroll in Medicare. But I don't see that being implemented. But there are limits to how much you can contribute. People, again, love to contribute it, but it goes for dental, right? It goes for eyeglasses. It goes for all copays. HSAs are great things to have, and you have plenty of time to use your HSA for years to come. It doesn't expire. This form is the request for employment form. If somebody is past the age of 65, and let's say they have Part A already, they need to get this signed by their benefits department or their HR, right? And it basically tells them, tells Medicare that you've had credible coverage past the age of 65, so there's no penalty. So this is just a very simple form. It has a starting date. It has an ending date of your coverage. And it's signed by the person in benefits or HR. And this form plus this form are the two forms that are needed if you're past 65 and going on to Medicare. This is a form that's signed by the individual. On the top line, it has your Medicare number, and that assumes you have Part A. And this is simply a form that has your Social Security number on it. No, this form does not, just your Medicare number on it. And on this form, we will type in for you, or you will write in, I'm requesting a Part B effective date of, let's say, November 1st. So if you decide you're retiring the end of October, and November is when you want Medicare to kick in, especially Part B, then on this particular form, we will write requesting Part B effective date of November 1st, or else the Social Security office will give it to you for the next month. So again, this is a part of what we do. We fax these forms. We've been faxing these forms across the country to the Social Security offices for 3+ years through COVID, and it has continued since. And so this form is the confirmation of employment, credible coverage. This is the form that asks for Part B to have an effective date of whenever you choose. I alluded earlier to this income adjustment. This is for folks who have been earning decent money 2 years prior. So you see that the Part B premium is $164.90 on the first line. That's for single people who have an income of under $97,000 from 2 years ago. So in this case, it would be 2021, or as a couple under $194,000. Again, it looks at what's called modified adjusted gross income, but I usually direct people to line 11 off of their federal tax return. If it is above those two numbers, you see that the Part B premium goes up. It goes up to $230, $330, $430, et cetera. And so this is what will be determined when they look at the tax return. And because a lot of people will have a drop in income, after they retire, the good news is that there is a form called the life-changing event form. Many people are not aware of this. I try to guide financial planners and CPAs on this all the time because this form gives you a chance to estimate, project current year's income. So if you were making, let's call it $300,000 in 2021, but this year you were projecting under 194 or just a bracket that's lower, you fill out this form, you project the current year's income, you submit this form, and as you can see, there's 8 different life-changing events: marriage, divorce, death of a spouse. But the 2 most common ones that we help people with, as often the case, is work stoppage or work reduction. You fill out that box, you put in your income, your projected modified adjusted gross income on this form, you fax it or send it into the Social Security office, and they will reduce it to a lower tier. If in fact, let's call it 2024, you actually, now that you don't have a full year's worth of income, you lower a bracket once again, you fill this out yet again. So for as many years as this continues to help you, this form is incredibly valuable. You can see that it can get up pretty high in terms of premiums, and people are incredibly grateful for this form that really helps them save a tremendous amount of money, especially if there's a husband and wife connected to this. You have an ability to save a lot of money by knowing and projecting what your income will be going forward in the current year or in future years. These are the enrollment periods that people often talk about. And these are really, this is one of the, I think, the important screens here, followed by the next screen. That 7-month window that I mentioned, that's that window of 3 months before, the month of, and 3 months after. This is, again, for unemployed, self-employed, or for people working for a company of less than 20 employees. Okay, that's the only people that really need to look at this initial enrollment period. The annual enrollment period is for those of you who may or may not even be on Medicare now and are looking to evaluate your plans going forward into the new calendar year. Starting October 1st, we have access to all the new plans for 2024. We're starting to see a little bit of information now, but we can't even utter a word about the new plans until October 1st. But from October 15th through December 7th, that's when we can actually help people, guide people, educate people on what kind of plans they may be interested in moving to. And so they may want to change their prescription drug plan. They may want to change their Advantage plan. Typically, people don't really change their Medi supplement plan, but this is the time of the year when the phone calls and the TV ads and the mail in your mailbox, again, you're going to see ads that you will notice that will be amazing. And not always true, but they're out there. Open enrollment period. This is actually for people who have an Advantage plan, who want to change to a different Advantage plan. This is not a marketed enrollment period. So for people who have an Advantage plan, which I'll talk about on the next screen, if they don't like their Advantage plan, they go to the doctor says, I'm sorry, we don't take this plan. They still have a chance between January 1st and March 31st to make that change. Special enrollments. Well, these are for people who are retiring past the age of 65. So those 2 forms that I showed to you just moments ago, these 2 forms are the forms that are necessary to establish a special enrollment period. And that is you're losing your employer coverage. That's what it's called, losing employer coverage. But there are other special enrollments. There are special enrollments for people who are going into a facility of some sort, a rehab facility. There are special enrollments for people who are on a pharmaceutical assistance program. In New Jersey, that's called PAD. In other states, it's called other things. There's special enrollment for people who qualify for what's called LIS, which is extra help for prescription drugs. There's a dozen or so special enrollments. And so when people call us mid-year and they want to make a change, we have to try and figure out what special enrollment we can get for them. There's also been some for fire and the flooding that has occurred in most of the states around the country lately. And Medicare puts in place some special enrollments that we're able to help people make a change. So these are special enrollments, again, of course, especially those who are losing their employer group coverage. This is, again, one of the key slides because you really have four choices when it comes to Medicare. You get A and B, you're retired. Option one, stay on your employer group plan, either a regular employer group plan because it's a better plan and you're not paying as much, or a retiree program. I help review them to see if they are better, but stay the course, don't change a thing. I'm happy to help people understand what they have and what their options are, but that's option one. Stay with what you have, don't make any changes. Option number two is just original Medicare, just A and B, nothing else. And the reason why people like original Medicare is because you can go to any doctor that takes Medicare anywhere in the country. So you're not in a network. It's 95% of all the doctors, but it's pretty close to 100, and people like original Medicare. Many people on original Medicare don't understand some of the other options, but they're at risk for the entire 20% every time they go see a doctor, go to the hospital, have any testing done. But if they're in good health, they want to see any doctor they want, they're willing to pay the 20%. There are people who are on original Medicare, and that's option two. Option three is the Advantage plans that I've alluded to. These are the most popular plans these days in other parts of the country, not necessarily the New York, New Jersey area, but a lot of the school districts, a lot of the New York City employees, a lot of large corporations are actually making people choose for and lean towards an Advantage plan. These Advantage plans are a network, right? And so there are some carriers that have very, very large networks. So I am not opposed in any way to an Advantage plan. I just think people need to understand the ups and the downs of them. But I do believe that it is going to grow in popularity. The estimate is that by 2030, 70% of all Americans on Medicare will be on an Advantage plan, but it doesn't work for everybody. Again, they're in a network. There's an HMO model or a PPO model. The HMO means you have to stay in the network. The PPO model means you can go outside the network at a little bit higher cost. So let's say that the cost for a specialist is $45. You go outside the network, maybe it's $75, $80, but you can go. And so people like PPO plans, not that they go outside the network, but they can. These are very low premium plans. So besides paying your Part B premium, you may have zero premium for the Advantage plans, but you pay as you go for every service. So primary care, specialty, x-ray, diagnostic, hospitalization, surgery, you're paying a copay for everything. Now, the most expensive part of these plans are often and usually hospitalization and surgery. So anytime you go into the hospital or have surgery, you can expect a bill on these plans of between $1,000 and $2,000. But there is zero premium. So people without chronic conditions who want to save some money often go to these plans. They include prescription drug coverage. They don't pay for the copays, but there's no additional premium. They often include other benefits, dental, eyeglasses, acupuncture, transportation, over the counter. There's a long list of benefits that these Advantage plans offer. And again, enticing you to get on this kind of plan. The truth is the government would like you on this plan because they rid their hands of it and they have the carrier manage the care. But again, I'm a fan of these, but the situation has to fit and people have to be educated on what they're getting or maybe what they're not getting. Med Supplement is often called, number 4, is often called Medigap. These are the plans that are the best plans in America. Depending on the part of the country that you live, these plans can go from anywhere from $100 to $300 a month per person. But you can go to any doctor you want anywhere in the country that takes Medicare, and you have almost no costs. So for people who are on, let's call it the Affordable Care Act, and maybe with a group plan that they're paying a lot of premium for, these are the best plans that they've ever seen. But they're paying a higher premium. And for some people who have paid almost nothing for their premium, this feels expensive. It's all part of, again, knowing people's health and budget. This does not include a prescription drug plan. So in addition to the $200 to $300 a month, you need to add, in most cases, a small premium plan. The average is between $15 and $40 a month, but there are plans that are less expensive and more expensive, depending on your medications, the frequency, the dosage, and your pharmacy. These plans, again, are the best plans in America. They're identified by plans like Plan F, Plan G, Plan N, and there's also a high deductible plan. But again, people love the flexibility of being able to go to any doctor they want. So folks, these are the four choices that one needs to look at when they actually get onto Medicare. So one of the things that we do is we look at your doctors. We look at your doctors, we look at various carriers, and you give us a list of your doctors and the facilities that you use, and we go and we do this work for all our clients. And if you call a carrier and you call them, they're going to just look up their carrier. They're not going to look up any other carriers. And that's the independent, objective work that we do. But this, I have staff that does only this. This is an important part of their work, important part of the services that we provide. So Medicare changes. In 2023, the Part B deductible is $226. So for those folks who may actually move towards a med supplement plan, also called Medigap, they have a $226 deductible for the entire year. That has changed over the years and will probably change again in 2024, but that's the current price. The Part B premium, $164.90. It was actually $173 last year, but the year before that, it was $148. So that Part B premium that comes out of either your Social Security check or is billed monthly or quarterly, that's the current cost. The Part D deductible is $505. Now, that's not a deductible for generic medications. That is deductible for brand named medications only. And so, again, an important part of our discussion with our clients or opportunity prospects is to explain to them how this prescription drug plan works. It's really, really critical. I can't emphasize it enough. Med supplement rates, through COVID, rates stayed steady, but now they're averaging at about 4 to 6% a year. So the premiums do go up on these Medigap plans.
I got a quick question, Mark,
Sure.
that kind of relates to that last slide.
Sure.
If you're looking and you take a Medigap, can you get a Medicare Part D?
So again, if you have a Medigap plan, you essentially have to get a Part D, or you would be penalized if you chose to do it later. So even if you're taking no meds, I always suggest you get a plan, strong plan, but a plan nonetheless. Let's call it $11, $12. But if you don't, and if you decide years later, you would get penalized for that. So yes, with a Medigap plan, you do need to add it. On a Med Advantage plan, it comes as part of it. I do see the questions here. So if it's okay with everyone, I'm going to just cover some of them at the end. Is that okay?
Yeah, that works.
Or you can interrupt me anytime you want.
No.
Is there another question you'd like me to answer, Justin?
There's some of the questions are kind of specific that we can kind of get to at the end or follow up with the actual asker.
Okay, I will do that.
Yep.
Thank you, folks, for the questions. I actually was so focused I didn't even see my other screen. So the insulin cost, that has been a big change, and more changes are coming. So the insulin cost in most states right now is most of the insulin medications have been limited to $35 a month. That was not the case 3 years ago. And so that's a really big savings for a lot of people. And insulin is certainly a big component of healthcare in this country. But if you've seen the press lately, there's other things that are being discussed. There's supposed to be a $2,000 limit on prescription drugs starting in 2025. And for some people, $2,000 would be a great savings. There's also the top 10 medications that are being negotiated with between the government and Medicare. And that is supposed to be 10 medications that we would love to see reduced in price. And that's not supposed to be till 2026. So, a lot of people are going to be asking about it during this coming open enrollment that won't be in place. Teleservices, that has grown a lot. You can't do a blood test through teleservices, right? And so, but it has increased the ability of, through COVID, of people to get the kind of guidance and health care that they might need. So med supplement plans. These plans they cover what most of Medicare doesn't pay. They're simple, they have the most freedom, they're standard nationally. So whether it be in New York or Connecticut or Massachusetts or Florida or Ohio, they're all the same if you're talking about plan letters. It makes it easy to understand. And they're certainly the preferred choice for the more affluent consumers where premiums are not an issue. The Part B premiums, again, in addition to the Part B premium, the cost is $100 to $300, and there's not a network. So any hospital, any doctor that takes original Medicare takes these supplemental plans. Again, no drug coverage, it has to be added, and it has the maximum flexibility with the minimum friction. What people are often concerned about on the Advantage plans are the friction. Is there friction? Are there denials? The answer is there are some, but not as many as people are concerned about. And there are always the ability to advocate and appeal. So these Advantage plans are through private insurance companies. They're a bundle. They're a bundle between the hospital, the doctor, the prescription drug coverage. They're all one bundle. They have low monthly premiums. Zero is not unusual for a monthly premium on the Advantage plans, but they vary by county. Even if you move from county to county, you need to look at what options you have. The maximum out of pocket for 2022 and 2023 was around $7,500. In places like North Carolina, the out of pocket is like $3,400. Right. And so it depends on what county you live and where you're moving. But again, these ancillary benefits are very popular. People want dental, and it's probably the most other benefit that people want. So gym membership is a close second. And these plans, again, they're low premium. And for healthy boomers without chronic conditions, they work really well and people save thousands a year. Dental has specific riders attached to them. In this case, it's a $24 rider for $2,000 worth of dental coverage. Not bad, depending on the county you live in and the carrier that you work with. They may have a rider for dental. They may give you the first $1,000. You may need to be in a network. And so, again, I just did a dental webinar, seminar. And I spent an hour talking about just dental because it is so important to people. And as people get older, it's dental, it's eyeglasses, it's hearing. And those are the three things that they really do want out of Medicare. And these are not covered by original Medicare or Medigap plan, but they are covered often to some extent by an Advantage plan. And even $2,000 isn't a lot. But the good news is that you're getting discounted rates. So, you're going to get a different discounted rate for a root canal or a crown than you would on a non-discounted rate, often by about 30%. This particular plan is a dental plan that is a standalone plan. So people who have either an Advantage plan or a med supplement plan can also add a dental plan. So you can see it's $57, $72, $82. The $82 plan offers $5,000 annual max per year. That's also a pretty good number, and it's also discounted rates. So Yes, it's true that things like implants are very expensive, but people have to determine whether they're loyal to their dentist. We run their dentist just like we run their doctors, and determine if any of these plans work for them, or they just want to pay cash for their cleanings, right? So the dental piece is really important, but this is one of the many, many, many carriers that offer standalone plans. There's Cigna, there's MetLife, there's Guardian, there's Renaissance, there's Humana. There's so many different dental plans, and dental coverage is important for people as they age. Prescription drug plans. I can't emphasize enough how important this is, because people who have expensive medications, their fear around this is larger than the medical side. Because once you understand the medical plan, then the question is always, okay, so how am I going to cover my expensive medications? And again, the annual deductible keeps going up. In 2022, it was $480. In 2023, it was $505, and it's, I believe, going up again a little bit in 2024. But that's just for brand name medications, not for generics. But there's copays, there's tiers, there's formularies. The prices change every year. Everyone on this call, or people you know who are on a prescription drug plan, should be looking at prescription drugs every single year, unless you're on generics or you really are on none. But this is really important. Some of the carriers will do a bait and switch, meaning that they'll have a low premium in the first few years. Then all of a sudden they'll raise the prices and or change their formulary. Some medications can go off formulary and be higher priced, and some can come onto a formulary at a lower price. So this is really important. But in addition, we guide people towards things like GoodRx and Single Care. These are discount cards that are not connected to your Part D plan, that in some cases offers people lower pricing. There's grants. There are ways to get through pharmaceutical companies some reduction of prices. So we help people in as many ways as we can. But there are 4 stages of prescription drug costs. It is not easy to explain. I'm not going to attempt to do it right now, but it goes from a deductible and after deductible cost, coverage gap, which used to be called the donut hole, into what's called catastrophic. So the price can start out at $300, go down to $47, go up to $120, and go down to $35, right? And so those 4 pricing components, the best way we can explain it to people is by looking at their monthly out of pocket. So in the month of, let's call it January, February, you have these costs, and the next 3 months you have these, and the next 6 months you have those costs. Because going through these stages is confusing for almost everyone I've ever explained it to or heard explain it. But we can certainly explain it through reports that we share often with our clients. So this is just an example of Medicare.gov. This is the site that we use, but you can see that the pricing ranges from $12, $7 to $39. You can see that Walgreens and CVS, in some cases, prices things out differently. And then there's mail order. So all of these things are reports, there's work that we do to help people understand. You see that the deductible is what it is, but this is, Walgreens is out of network on the one on the right for SilverScript SmartRx, right? And so the price can vary by pharmacy, by prescription drugs, and for the premium. So all important work. So again, there's lots of places for information. Start with your financial advisor, but certainly Medicare.gov, there's, Office of the Aging, there's books that you receive. I started out with 20, now it's 22. I believe I'm up to 25 states I work with. But again, it's really, it's what we do, and that's what we love to do. So the takeaways here, you need to recognize the importance, I believe, in the integration of healthcare costs and financial planning. It's really connected. Healthcare costs are not cheap and need to be put into the financial plan. My feeling, honestly, is to seek objective information. Don't call the insurance company from an ad on TV or a piece of mail in your mailbox. Find somebody who can really objectively guide you in the area of Medicare. During AEP, which is October 15th through December 7th, and before retirement, look at Medicare, discuss Medicare, understand your options, your timing. The timing of Medicare A and or B, it's important, and it's not obvious even if you talk to your friend or your neighbor or your relative. You're going to get different answers from different people. But the decisions start at age 65. And I always encourage people to reach out 3 to 6 months before they turn 65. It could be a 5-minute conversation, but at least they'll feel like they understand what their next steps are. Looking at your doctors and meds, looking at your chronic conditions or special health needs, that's really what this is about. Healthcare costs are a part of, one's planning, and one has to look at what the projection is. Understanding the Advantage and the Medigap options, that's really those two options, number 3 and 4, that one needs to look at and understand. Dual special needs, people on Medicare and Medicaid. There are very nice, sweet benefits that for people who are on both, and that are available throughout the country. And identify a resource that you have. But again, talk to a specialist, not a call center or a carrier. Okay, so that is the presentation. I'm going to go to the questions. 62. When I turn 65, will my private health insurance become secondary? So if it will continue after John passes, I would say, again, I always say that this is an individual scenario that I would like to speak to privately, but I would say that if in fact the insurance is excellent and you're not paying a lot, you're going to stick with it. If in fact you wind up finding out that there's a premium that is higher than you could get elsewhere, then you might switch to Medicare. But that really is a individual decision. I would say that it's likely that you would stay the course, but I'm not sure. So health savings account, I earn dollars. Is this an HSA? So no, what you earn credits? No, and a health savings account is a type of insurance policy that has a high deductible. So you had to have opted in to contribute on your own, or the company may be contributing a little bit on your behalf. But I believe the limits are $3,600 for one person, double that, and then there's over 55. There's $1,000 catch-up. So you can put away $7,000, $8,000 a year, but you would generally know if in fact there was a health savings account offering within your company. Is there another question here? Do we work in Maryland? Yes. Is there contact information? Well, it's on the screen. That's our phone number. That's our website. There's a lot of really good information on our website. And there's also YouTube. There's a lot of information, including information on dental. Are there any other questions that I'm missing, Justin?
I think that's it. So the best way to contact you is that that number on the screen?
Yes, or of course through you. Yes, I hope this has been helpful. This is what we do, and we love what we do. Staff of 7, and this information I think is important to just know and have a sense of the various options that are out there.
Awesome, Mark. Well, thank you so much for giving that fantastic overview of Medicare. And I know we could probably go on for a couple other hours if we wanted to go into each and every little detail of it. Like you said, dental was a full hour seminar in and of itself. So thanks so much for that. David, can you wrap us up here and give us a preview of our next webinar?
Absolutely. So our next webinar is going to be on October 4th. That's going to be a Wednesday at noontime. So we always do these webinars on the first Wednesday of the month. So you can mark your calendar. October 4th, we have a special speaker in Chris Holtby, who's going to be talking about Trust Explored. a comprehensive guide to trustees and asset protection in estate planning. And I will tell you the reason we asked Chris to speak is because this is an area that we do get a lot of questions about, the area of trust and naming trustees and beneficiary arrangements on your estate plan. So Chris is going to be looking at doing an overview of what trusts are, talking about how to choose the trustee for a trust, and that's an important decision right there. And then building an asset protection program through the use of trust, and then ultimately getting into navigating the legal and tax implications. So please join us on October 4th at noon to hear Chris speak about trust planning. Also, I'll remind everybody that this presentation, as well as all of our presentations, have been recorded, and they will be posted on or all of the past ones have already been posted on our YouTube channel. In about a week, this will be posted as well, and we'll send out an email to let you know when that has been completed. So one way to follow what's been going on is to follow our site on YouTube, subscribe to our site on YouTube, and that way you'll be notified once a new program is added to the site. So thank you, Justin. And with that, I'll turn it back to you.
Thanks so much, David. Thanks again, Mark, for your presentation. And if you have any questions, feel free to reach out to us or contact Mark at the number there you see on the screen. Thanks so much.